After India and Nepal, the Omicron variant has hit another South Asian country, with Pakistan recording the highest single-day cases ever since the pandemic outbreak. The government has imposed stricter curbs and is planning to ramp up vaccination drive. However, the experts are critical of the government's move, saying it is not just doing enough to contain the spread.
A sudden spike in the number of infections has sent worrying signals to authorities in Pakistan. With over 7,000 cases, the country recorded its largest single-day count ever last week. Pakistan authorities say that the positivity rate is around 13%, but the observers have argued against it, saying that it is due to the low testing that the country has managed these figures. Karachi, the country's largest city, has 1 out of every 2 people tested positive. The vaccination drive in the country, which has largely relied on other countries' supply, hasn't given promising results as yet. However, the government of Pakistan has already paved the way for the booster doses for healthcare workers and people who are over 30 and immunocompromised. Not just the government, the common citizens in Pakistan had also grown complacent with decline in the number of cases in the previous wave, but now the centers are witnessing a spike in those turning up for the doses.
लोगों का रुझान तो है, बूस्टर्स के लिए भी लोग आ रहे हैं, ठीक है ना। सेकंड डोजेस भी जिन लोगों ने होल्ड कर दी थी वो लोग भी जो है वो अब रुक कर रहे हैं सेकंड डोजेस के लिए, जिनका 4 to 5 months का गैप है। तो डेफिनेटली लोगों में रुझान तो डेवलप हुआ है। वो जो बीच में एक ब्रेक आ गया था, तो अब लोगों ने जो है वो उस ब्रेक को जो है वो कंप्लीट करना जो है वो शुरू कर दिया है। तो ठीक है, थोड़ा सा तेज़ी आएगी, उम्मीद तो यही है हमारी कि लोग आएंगे।
Vaccination of children over the age of 12 has been made mandatory to attend the schools, and children under 12 will attend schools with 50% attendance. About 70 million people in Pakistan, or 32% of the population, have had 2 vaccine doses. Despite this low immunization and the World Health Organization issuing repeated warnings about not ignoring the pandemic as yet, many people in Pakistan are of the view that the country has passed its worst phase and there is nothing to worry about anymore.
डर खौफ तो नहीं है, चूँकि शुरू में था। जब मार्च में पिछले सालों में जब कोरोना आया तो उसमें लोगों में डर खौफ था। उसके साथ साथ चूँकि हमारी गवर्नमेंट ने उस बड़ी अवेयरनेस पैदा की, हमारे मीडिया ने, हमारे तमाम मामलात ने, जो NCOC ने, उन्होंने, तो लोग बाशऊर हो गए। अब उनको तमाम पता है कि चूँकि ये एक बीमारी है, वबा है, जिसको हम अपने तरीके से टैकल करना है, सोशल तरीके से हम उसी तरीके से ज़िंदगी गुजारनी है उस वबा के साथ।
As per the data released by the government bodies, the infection ratio in Pakistan is lower as compared to other South Asian countries. However, pressing questions have been asked of the government regarding the tests conducted by it. Pakistan, which is 6 smaller than neighboring India in terms of population, has conducted an average 50 to 60,000 tests per day compared to India, where around 1.9 million tests are being done per day, around 30 times more. The government is, however, under the impression that what it is doing is in the right direction.
आजकल हम कोरोना की इस लहर में गुजर रहे हैं। 5वीं लहर है, बहुत सारे केसेस हैं, बड़े शहरों में लगातार नज़र आ रहे हैं। कराची में आप देख रहे हैं 40% से ऊपर जा चुकी है पॉजिटिविटी। लाहौर, इस्लामाबाद, हैदराबाद, दीगर शहरों, पिंडी, इधर भी केसेस बढ़ रहे हैं और आपने NCOC के ज़रिए इसके बारे में इक़दामात भी सुने और वैक्सीनेशन भी लग रही है।
Pakistan's largest city, Karachi, had earlier launched a door-to-door campaign to vaccinate women who are lagging behind men in rates of coronavirus inoculation. The government claims that it has been taking all steps to keep COVID variants spread in check, and testing will be ramped up in coming times. However, as per several media reports, even after nearly 2 years of pandemic outbreak in the country, Pakistan has failed to manage even good testing kits. The majority of COVID-19 testing in Pakistan may be yielding inaccurate results, according to health experts who reported that nearly 80% of imported testing kits were of substandard quality. There is no uniform national policy regarding COVID-19 testing in Pakistan, resulting in unregulated testing practices and the use of low-quality kits in many health facilities.